Dr. John, let's start here. In terms of from where you sit and from where you see it, the situation with COVID-19 at this point in Antigua and Barbuda.
So I think we are clearly in a very dire situation at this point.
We have it up now.
What you see here
Yes.
is that we are now on that cliff-like upward spike. And when you see that happening, that means that the spread is really almost logarithmic at that point. When you get on this part of the curve, it's very difficult to get off without very drastic measures. Just for a little explanation, I don't know if the color is coming out clearly on your screen.
Yes, there are colors coming out. So there's the blue, yellow, green, darker blue, and red.
Right. So the light blue is basically the total cases in Antigua. And as you see, all in November, in December, into summer, January, we're tripsing along on that horizontal line, inching up. You can see now in the last 2 weeks, in the last 3 weeks, or even 4 weeks, things started happening. And fast forward to now, we're basically on a vertical spike, okay? Now, the yellow line has to do with community cases. The green line has to do with imported cases. Now, as you can see, this is all due to community cases. The dark blue has to do with active cases. And so all of those, except for the non-community or imported cases, are on this precipitous curve. I want to draw the most important thing, I think, in this graph to your attention. If you look at the red line, that is hospitalized cases. Now, what's happening with that is you haven't seen the spike yet. You're still on the 45-degree kind of angle on the graph line there. Well, that stands to reason, because we know from all the other countries and their graphs that the hospitalized cases, in terms of the steepness of the graph, that lags behind the cases itself. And so what this is telling us is that within a week to 2 weeks, maybe 3 weeks, we're going to see the same precipitous rise in the hospitalized cases that we're seeing in total cases. In my opinion, there's virtually no way we cannot see that, given what we're seeing now. Right now, I know for sure that there are over 50 cases, probably going on 60 cases, hospitalized in Antigua right now between the two different institutions. I know that as a fact, 7 of which are on the ventilator. There were 8 on the ventilator just this weekend. No, that's a breakneck situation for the hospital. Beyond that, they will not be able to cope. In my opinion, we are going to move beyond that soon. So it is so very important that we get really drastic and not only tighten up on the measures, but to some extent change some of the courses.
Is it a case where we're seeing, because early in last year, the number of hospitalizations was not as high. Is it that more severe disease is happening? Why do you think that's happening now?
No, it's not more severe. It's the same proportion, except there's so many more cases that are coming on stream. We're now seeing, in my opinion, what we call logarithmic or nearly logarithmic spread in the community. We do a lot of testing and we see it firsthand.
Yes.
And remember, and I want you to remember something. We're not doing a whole lot of testing, relatively speaking. If you look at other countries and other islands, they're doing a lot more testing than we are. But even with what we're doing, we're finding these huge numbers of cases that we didn't have before. So that tells you that things have kind of gone awry. You are looking at a situation where you have 50 people or more in the hospital right now, 7 of which are ventilated. I mean, that's a very scary situation because our health, listen, I don't care if you have 50 ventilators, you're not going to be able to handle much more in terms of ventilated patients in an adequate manner. It's just not possible. We have limited resources. We have limited personnel. You know what happens when a patient goes on a ventilator with COVID? They usually stay on for quite a while. So those just build up. You know the kind of resources that are used on one patient with who's on a ventilator, astronomical amount of resources. If we get into that situation where we see those ventilated patients go up, we are going to be in some painful stages.